In the case of Jennifer Eden versus AU Hospital, in regards that AU Hospital violated Jennifer Eden's HIPAA privacy law by releasing private medical information without consent from the plaintiff. The defendant in the case claims they made numerous attempts to reach out to the plaintiff regarding the release of her PHI by phone, email, and letters sent to her home address. However, it is not made clear how many times the defendant attempted to contact the plaintiff and whether or not these attempts were documented for the case as evidence. The Privacy Act provides no agency shall disclose any record which is contained in a system of records by any means of communication to any person or to another agency, except pursuant to a written request by or with the prior written consent of the individual to whom the record pertains. On the side of the plaintiff, if a written subpoena were sent to her residence, such as important document would have needed signature consent at the time of delivery from the mail carrier, ensuring that the plaintiff did in fact receive the document. This would have been written proof that the plaintiff did indeed receive the written subpoena for her medical and personal identification to be released. The plaintiff's testimony discusses her breach in confidential medical and personal records without her consent for these records to be released. Every medical facility has every patient sign a privacy policy to the extent that none of their medical or personal records be released without their prior consent. It has been made clear that the plaintiff did not consent to release her medical records prior to them being released. Idaho State University, for example, recently paid $400,000 to settle the breach of unsecured electronic PHI of 17,500 individuals who were patients at the university clinic. As the result above, employers at every level of healthcare have developed a zero-tolerance policy related to patient confidentiality. Jennifer has expressed her invasion of privacy and need for compensation in this case. It is my ruling that the plaintiff receive $100,000 as requested by the plaintiff be given as compensation to her personal and medical privacy being violated in this case.